Hello, I'm Richard Mondak. I'm a physician assistant. I've been a PA for 33 years and practicing occupational medicine for approximately 23 years. I've been with Worksite Medical since 2011. Silica testing is based upon the fact that the most common element in the world is silica. It's sand, dust, and not just your ordinary house dust or dust that is accumulated through time and moving around and other work. Silica is a specific irritant to the upper respiratory and specifically to the lower respiratory system. It causes problems over a long period of time. Silicosis, or the complications associated with silica exposure, takes a long time to develop. What happens is, if you think like the lungs are moist and dark, if you put moist sand together for a long period of time, what happens when it's processed, when it gets into the lungs, it gets into not just to the lung tissue, the lining of the lungs, and it gets hard and it becomes like concrete, and lungs can't expand and it becomes very restrictive. What we do is provide surveillance examinations for the initial type of exam when you're first exposed or prior to exposure in many cases. However, not all employers have been proactive in doing that. What happens is, over time, that respiratory conditions can develop, and you have to make sure that you have, a healthy standpoint or starting point. So what we do is surveillance testing for pulmonary functions tests, spirometry. How much is your lung capacity, your baseline, so you don't have obstruction disease. People have heard of emphysema or COPD. We do chest x-rays, and they're read by a specific radiology specialist called a B reader, who are specifically trained and certified to look for long-term changes in the lungs from silicosis, asbestos, or other potentially harmful irritants to the lungs. We will test for respirators and make sure that you're using the correct respirator for the job. And we also do a complete respiratory physical examination and a history based on the OSHA standards to determine what things that may have been present in the past or in currently, such as tobacco smoking, the job that you're doing now compared to jobs you've been doing in the past, or how long you've been doing the current job. Some folks who have been doing this for many years didn't have the benefit of OSHA providing standards and may have been exposed without proper protection. Well, how it affects the employee is, in a negative connotation, that they're going to have this disease and they're going to wonder how they got that. That's going to fall back on, and even a primary care physician will ask, what did you do for your job? And put that together, and put that evidence together and say, well, this is work-related. This sounds work-related. And then going back to the employer and requesting records. OSHA could come in and fine the employer, or actually just close it down until they're compliant. So it behooves the employer to always be within OSHA standards, not just within, but to the maximum. And some forward-thinking employers will be above the OSHA standards. At Worksite Medical, you can come to us, or you can let us come to you.